Today we are going to start our next topic, which is about thyroid gland. As we know that thyroid gland is an endocrine gland that has two types of secretory cells. It consists of follicular cells and that secrete the triiodothyronine and tetraiodothyronine, which is also called thyroxine. And these follicular cells called triiodothyronine and thyroxine are involved in the growth of the individual and also increases the metabolic rate. Thyroid gland also has parafollicular cells, and these cells basically deposit calcium in the skeletal tissues and decreases the level of the calcium in the blood. So parafollicular cells, they are basically involved in hypocalcemia, and the functions of parafollicular cells, they are basically opposite to the parathormone, basically that increases the calcium level in the blood. So in short, thyroid gland is involved in increasing the basal metabolic rate. It is involved in the growth of the individual and also decreases the level of the calcium in the blood. Now let's talk about its location and extent. As we can see in the diagram that I have drawn thyroid gland. This is thyroid cartilage, thyroid bone. It can be seen that a thyroid gland extends from middle of the thyroid cartilage towards the fourth tracheal ring, and thyroid gland is present against the C5 to T1 vertebrae. So thyroid gland is present against C5 to T1 vertebrae, and it extends from the middle of the thyroid cartilage towards the fourth tracheal ring. And on average its weight is 25 grams, and thyroid gland is larger in females as compared to that of males. Thyroid gland has two borders and three surfaces. It has anterior border, it has posterior border. It has three surfaces: medial surface towards the trachea, and this is lateral surface, and posterior surface is present. It also has an apex and base. So thyroid gland has two borders: anterior border, posterior border. It has medial surface towards the trachea, it has lateral surface, and posterior surface. It has an apex and a base. Let's talk about capsules that surround the gland. As you can see, I have drawn false capsule with orange color and true capsule with green color. False capsule is basically derived from the pretracheal layer of the deep cervical fascia, and which is thick along the inner surface and form a ligament of Berry, okay, which is connected to the cricoid cartilage. True capsule is basically the peripheral condensation of the connective tissue of the gland, and venous plexus is present just deep to the true capsule. In this image, false capsule can be seen, which is derived from the pretracheal layer of deep cervical fascia, and false capsule is thick on the inner surface of the thyroid gland and is connected to the cricoid cartilage in the form of ligament of Berry. If we reflect the lobe of the thyroid gland, then ligament of Berry becomes visible, which is attached to the cricoid cartilage. Let's talk about the blood supply of thyroid gland. As I have drawn thyroid gland with right and left lobe. This is arch of aorta. These are the branches of arch of aorta: brachiocephalic artery, left common carotid artery, left subclavian artery. As we know that right and left subclavian artery divides into external and internal jugular vein. I have drawn some arteries. These are superior thyroid artery, inferior thyroid artery, and sometimes lowest thyroid artery is also present. Superior thyroid artery is basically the branch of the external carotid artery. It runs downward, pierces the pretracheal layer of the deep cervical fascia, reaches the upper pole of the thyroid gland. Over here, it divides into anterior branch and posterior branch. I have drawn posterior branch with the dotted line. Anterior branch then travels along the anterior border of the lobe and then along the upper border of the isthmus and anastomose with the anterior branch of the opposite superior thyroid artery. Suppose this dotted line is the posterior branch of the superior thyroid artery, which descends along the posterior border of the lobe and anastomose with the ascending branch of the inferior thyroid artery. Inferior thyroid artery gives a ascending branch that anastomose with the posterior branch of the superior thyroid artery. Inferior thyroid artery is a branch of thyrocervical trunk which itself arises from the subclavian artery. It ascends upward and medially, reaches the lower pole of the gland and divides into 4 to 5 glandular branches. One of the branch called ascending branch of the inferior thyroid artery anastomose with the posterior branch of the superior thyroid artery. Sometimes lowest thyroid artery is also present. Lowest thyroid artery arises from the brachiocephalic artery or directly from the arch of aorta. Lowest thyroid artery then reaches the isthmus. Now let's talk about the venous drainage of the gland, and as I have drawn thyroid gland right and left lobe, internal jugular vein, right and left brachiocephalic veins. So thyroid gland has superior, middle and inferior thyroid veins. Superior thyroid vein emerges at the upper pole of the gland and finally drains into the internal jugular vein. Middle thyroid vein emerges at the middle of the thyroid gland and finally drains into the internal jugular vein. Inferior thyroid vein emerges at the lower border of the isthmus and finally drains into the left brachiocephalic vein. Fourth thyroid vein may emerge between the middle and inferior thyroid vein and finally opens into the internal jugular vein. Nerves of thyroid gland are mainly derived from the middle cervical ganglion and partly from the superior and inferior cervical ganglion. These are vasoconstrictor.